Hi class, we are now in Unit 3. You're going to be focusing on anxiety disorders as well as somatic disorders, how they're related, and understanding a bit about really one of the most prevalent diagnoses there is between anxiety and depression. There's a lot of overlap and gray area that is shared. So when you're looking at the DSM, if you have one, or if you're looking at the criterion to diagnose for anxiety or depression, there's a lot of shared symptomology in the space in between. And some individuals who are impacted by anxiety are also impacted by depression and vice versa. But here you're going to understand the three components of anxiety, right, and how they function, the impact on the biological, social, and psychological factors in the manifestation and maintaining of anxiety. And then how anxiety really is an underlying factor in the development of OCD and somatic disorders, and kind of how that has to be treated in addition to treating the symptomology of just the OCD and the somatic disorders, right? And then lastly, this unit focuses on PTSD as well. And so PTSD has previously been thought of as a disorder really just related to those who were in wartime or veterans, have been exposed to service, or been in those first responder service professions. And really we're seeing that far differently in the past maybe 15, 20 years, and looking at trauma, isolated trauma, chronic exposure to trauma as really being a contributing factor to PTSD. You may have heard how we're seeing similarities in traumas of exposure during childhood development, and how that has some PTSD lasting effects later in adulthood. So the term has been ACEs, so adverse childhood experiences, where one is exposed to sustained amounts of trauma. So that you're looking at domestic violence, or like chaotic homes, exposure to drugs and alcohol abuse by a primary caregiver, neglect, abuse, malnutrition, food insecurity. They can all be contributing traumas to one's development. So in this chapter, I just want you to kind of read and take in that information and kind of see how it applies to what you've already known, what you're seeing in the field, what you're hearing, and maybe what you're interested in. I look forward to, again, your discussion boards, your engagement, and if you have any questions, feel free to reach out. Thanks.